Most common reasons are anal fissure, hemorrhoids, and anal tags. Anal tags are usually remaining after prolapse of hemorrhoids or after anal thrombosis. So these three diagnoses are the main reason of this symptom. Anal problems I would evaluate at the same amount, but people don't speaking about that and not talking. So suffering on its own. If you see how many creams for treatment of so-called hemorrhoids are on the market and how likely they are bought and paid, so I think it is a very, very common problem. Pain is a little bit important of the grade of pain. High-grade pain is describing mostly an abscess. Lower pain can be an anal thrombosis, that is a blood clot in the external vein. So these two things, and in worst case, it can be incarcerated hemorrhoids as well, internal hemorrhoids coming out. But in this case, in the last described case, the patient has already a history of hemorrhoids before. It's not the first time coming with this incarceration. Two things. First, and the most common one, is the anal fissure. Another thing are, I would say, hidden hemorrhoids. That means when you imagine that we have an anal canal of 4 to 5 centimeters, and in this anal canal, during the defecation, hemorrhoids will enter the lower part of the rectum, prolapse 1-2 centimeters. They are not visible, they are not palpable, but they are in the anal canal, create the pain and slowly retract. So usually this pain disappears after 30 to 60 minutes. Most it is related to anal fissure. Hemorrhoids rarely have symptoms of bleeding. The anal fissure is an ulceration in the anal canal, and of course the epidermal, the superficial skin, is damaged, and it is an open wound. Of course, if defecation is, if any other irritation by sweat or by scratching of the buttocks, it can be blood coming out. Anal itching is a big issue. Mostly it is additionally to the symptom of post-defecation pain. So the pain what we described before about after the visit at the toilet occurs. Because this prolapse is an enlargement of the mucosa, and mucosa is always, what's the name saying, producing mucus, and this mucus slowly disappears over the day and can irritate the skin, and that leads to itching. That is the most reason. Of course, there are dermatological diseases as well, eczema, psoriasis, inversa, but that are simple, visible changings at the skin. But itching without any redness and without any other clear symptoms are mostly enlargements of hemorrhoids. Let us speak about two things, the chronic anal fissure and the hemorrhoids. The chronic anal fissure is mostly, if people come, acute occurring chronic pain. And they are suffering a lot. And the operation strategy is to excise the anal fissure and create a bigger drainage triangle. That there is no collection of any liquid or any dirt inside the area. It is coming out, running out, drained out. And these people are instantly, despite the wound is fresh and bigger after operation, they are instantly free of pain. Compared to the pain, to the severe pain they had in advance, the days before. That is unbelievable, it's surprising me every time, but it's real that this strategy helps. For the hemorrhoids, the nowadays procedure to lift in by stapling or by lifting procedure with suturing, all these strategies are new and have no more cutting included. So that the wound outside in the sensitive area is not anymore occurring, and of course the pain is much less. And the healing period after these operations is very, I would say 2 weeks. 2 weeks when we, with open surgeries, have sometimes 8 to 12 weeks healing period.